Hi team, I just wanted to run you through a quick nerve glide flow sequence for the hips and pelvis. Let's jump on down to the ground. The first one we're going to do today is a hip flexor nerve glide. So we're going to start off with our knee directly underneath our hip, our toes curled under the track start, nice and strong and stable in our front leg. And our hips are facing straight on. We're not leaning out to the side, straight on through here. The first part of this is belly button in. So we breathe out, suck that belly button in, we then pelvic thrust. So we're rolling that pelvis under into a posterior hip tilt. From here, you should feel that kick in straight away. The third and final part is we squeeze our bottom as hard as we can. So rub, pinch, slap and stimulate the bottom so that you get better sensory input to help with motor recruitment. Keep your belly button in, keep your hips turned on, squeeze that bottom as hard as you can. You'll really feel that hip flexor nerve kick in. From here, we're just tensioning the nerve, decreasing, tensioning the nerve, and then letting that tension go. And we're going to do about 12 to 15 reps through there, looking to keep the tension at about 3 to 5 out of 10. We're not looking for pain here, we're just looking for a slight stimulation of that nerve. Put it into tension, then release through there. The next drill we're going to do is a saphenous nerve glide. So with our saphenous nerve glide, we're working a sensory aspect of our femoral nerve. So we're going to stand up nice and tall. We then lunge away from the body. The outside part of my straight leg, the outside part of my foot of the straight leg comes off the ground and I rotate into my lunge leg. From here, keeping my torso nice and upright, I bend to my front knee, dropping down through here, feeling the adductors in and out, just tensioning, lengthening that nerve and then releasing that tension. Again, about 12 to 15 drop downs before standing up and reassessing your range of motion. In between each drill, test and then reassess how you're moving and if you're getting any relief from there. The next drill we're going to do, we're going to come down to the ground, we're going to do an obturator nerve glide. So the obturator has two aspects. It has an outside and an internal aspect. Today we're going to focus on the outside part of this nerve. Now, I'm going to start with my left leg straight and my right leg directly underneath my hip. From here, I'm going to take my right foot across and underneath my body. So it starts here at normal and then it comes underneath the body at about a 45-degree angle. From that position with my left leg nice and straight, my right foot, lower limb crossed underneath my body, I'm going to drop back and down and you should feel a slight stretch, slight pulling. You can see I have to adjust my leg to increase or decrease the tension based on how you're feeling. And I'm just dropping back here about 12 to 15 times again, just feeling that slight pull on the outside part of my hip around to my tailbone and out to the greater trochanter. So just feeling that whole hip structure being lengthened out and pulled out through there. So again, 12 to 15, we're not looking at generating too much stress through this position, just a nice little stimulation of the area. Following on from that one there, test, reassess your range of motion, have a walk around and see if you've had a change in pain. The fourth and final drill in this sequence is a sciatic nerve drill. So I'm just going to grab a chair or grab a bench. We're going to sit down on that chair, we're going to sit up nice and tall and then we're going to put our chin down to our chest and fold all the way down and fold down. By doing this one here, we're just trying to lengthen that nerve. I then curl my right foot up, so I'm dorsiflexing my ankle, and with my chin down, I'm bringing that leg all the way out to the front and back down. All the way out to the front and back down. You can keep that head down for added effect. Bringing that leg up about 12 to 15 times. You can even start to bring or internally rotate that foot to do a little bit more of the outside aspect of that sciatic nerve. So we're just dropping in about 12 to 15 times, nice and relaxed, before then reassessing or retesting your range of motion, your pain levels, your movement ability, and your discomfort. Now, do one drill, test and reassess. Do the next drill, test and reassess. Work through all 4 drills. You might find that one works particularly well, or you have to get through the whole sequence before you notice the benefit. That's completely fine. Just work at your level, avoid pain. We're looking at stimulation, not annihilation. We're looking to lengthen and floss those nerves and unglue them, for want of a better term. So we're not looking to completely crush them, or it's not like a really deep tissue massage where you want all that feeling. Just stretch those nerves out, move them around, let me know how you go.